Two.
Hello, everybody. Good afternoon, and welcome once again to a weekly media briefing and public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgilio, Hispanic Public Information Officer in Montgomery County Government. And joining us today is Health Officer Dr. Keisha Davis, as well as Dr. James Bridgers, who is the Chief of Public Health Services, Mr. Sean O'Donnell, Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services, and Dr. Earl Sauter, Assistant Chief Administrative Officer. Thank you, everybody, for joining us. Members of the media, remember to use the chat during the Q&A portion of this presentation. And with that, good afternoon to you, Mr. County Executive.
Good afternoon, and good to see you again. Thank you for hosting the groundbreaking today. And I'm going to start with the groundbreaking today, the story of the groundbreaking of an affordable housing development at Randolph Road and Veers Mill Road in Silver Spring. It's the county government's largest investment in an affordable housing development. The county partnered with Habitat for Humanity and AHC in getting this project done. It is about 200 homes, 195, I think, to be precise, that are going to be added to this community. The redevelopment was envisioned, or some redevelopment on the site was envisioned in the master plan that was done for the Veers Mill corridor. And we took advantage of that master plan change to look at the county's property there and come up with this very innovative project. It's one of more than a dozen projects that we are in the process of doing on county-owned land that offers deep discounts and asks developers to bring creative, affordable housing projects. I was recently updated on the process of the response that we received to our first 18 county-owned parking lots that we put out. I just green-lighted 2 more projects in that list. And just this week in our CIP recommendations, we had great news in terms of our naturally occurring affordable housing fund, NOAA, as it's abbreviated, that's being replayed really quickly. We put out a little over $30 million to a project last year. We got $30 million repaid to us this year. It's a big deal, and it's very, very significant in terms of our ability if without that money, the nonprofit wouldn't have been able to acquire the building they acquired, and we wouldn't be getting this money back and recirculating it. So you take that together with what we did today, the 195 units, they have units affordable at 30% of area median income, affordable at 40%, affordable at 50%, and affordable at 60%. They include 3 and 4 bedroom units. We don't get 3 and 4 bedroom units in our developments in Montgomery County. Developers only have to give us a percentage of what they otherwise build in the buildings. If you look at places like Bethesda, they're not building 3 and 4 bedroom units, primarily 1 bedroom and 2 bedroom units. We could never have gotten the affordable number of units that we got if we had followed a development process that the county law prescribes when we're dealing with private developers. So our taking the steps we did to use our land and to dictate what we wanted on our property enabled us to achieve things that this county just flat out doesn't get normally. And that was recognized by speakers from the state as well as other folks of the real significance of the project. So I'm excited about it, and I'm excited that we're going to be doing more of these things. Yesterday, I was joined by many of Maryland's new state leaders and old state leaders to meet in Annapolis for the historic inaugurations of Governor Wes Moore and Lieutenant Governor Runa Miller. And I'm very excited and optimistic for the opportunity to move Montgomery County forward in ways we couldn't do before. We share many of the same values as the Moore-Miller administration, including an emphasis on clean energy and public education. And as the governor mentioned yesterday, clean energy can define our economy. And we've led the state in implementing climate-friendly initiatives with our building energy performance standards, by electrifying our vehicle fleets, by opening the nation's largest bus microgrid for electric buses, and placing a ban on natural gas in most new buildings and home construction. These are all important things that we're going to see reflected in the work that the Moore administration does. It makes us very optimistic. The governor also emphasized using state education system to help every child, no matter where they are in struggling with education. We know that there are learning challenges brought on by the pandemic and mental health issues that we hope to address here in Montgomery County by expanding our wellness center programs in public schools, which are included in my capital budget proposal this week that we transmitted to the council. I like and support Governor Moore's an innovative year of service for graduates out of high school. This is an example of a new idea we need to, really seriously consider, because we have so many youth leaving high school who are disconnected and have no clear path forward, particularly because too many of our high schoolers leave high school unprepared with the skills they need for work. If Governor Moore can make a program like this work, it can be life-changing for our youth, as well as an asset to our state in helping grow the talent of our workforce, which helps us attract new businesses and growing businesses. I'm also encouraged that Governor Moore is prioritizing to make the state more business friendly, as well as raising the state's minimum wage. I mean, one of the things that he pointed out yesterday is that we can both be more socially just and more business friendly. These are not conflicting terms, and it's good to see him recognize that raising wages is a critical part of building a juster Maryland, and frankly, more successful people who work for a living. Maryland is asset rich, but strategy poor, and I go along with that very much. We've done a deep dive at, why the county is not able to do some of the things that our neighbors across the river do. And it's really clear that we have totally outdated and inefficient and ineffective, processes in place that other people have learned how to improve on. And I think that, we need to look locally, just as the state's going to look broadly, at what we can do different in Montgomery County and in Maryland that help us become more successful, and particularly in attracting and developing new businesses and the jobs that come with them. So it's really great to have a partner that thinks about things the way we're thinking about it. And we know that success in Montgomery County can help the state provide funds for communities in need across the state of Maryland. So we play a symbiotic role. We always try to remind folks in Annapolis the things they do to help us are things that really help the state as well. So we all benefit when Montgomery County is able to take advantage of some of the opportunities that we're fortunate enough to have here, and that our success pays off for many other people in the state. As we continue to deal with the COVID pandemic and continue to protect the health and welfare of our constituents, I'm looking forward to working with this administration on closing the equity gaps that exist in our health, education, and planning investments and processes. There are, people like to say we discovered this during COVID. The only people who discovered it were people who weren't awake in the pre-COVID period, because many people have been talking about health and education disparities for a long time. And COVID may have brought this to more people's consciousness, but it wasn't new and it wasn't hidden. It was right there in front of us. Governor Moore, Lieutenant Governor Miller, and Comptroller Brooke Learman, and Attorney General Anthony Brown make up the most diverse leadership team that the state has ever seen. And it's a group that's well suited to represent our diverse county because they are leaders from our community. The governor's right when he says in this week's swearing in that the swearing in is not a victory, but an opportunity to change lives for the better. And I look forward to that challenge and taking advantage of this opportunity. On Tuesday, we transmitted our $5.4 billion CIP capital improvements budget to the County Council for their review. This is the second year of the county's 2-year capital budget. And normally, the second year is a year of adjustments where you make minor tweaks here and there for, some small project cost increases or decreases, or things that had to be done that you can't put off, say like a failing stormwater project where you can't wait another year to put it in the CIP. You have to address it now. So typically the adjustments are limited, and they either meet our amendment criteria or we wait until the next full CIP, which will be next year. After 12 years of being on the council, dealing with, really, bad budgets and tough choices year after year, this is a relatively good news budget. However, high inflation due to supply chain issues, labor shortages, and a tight construction market has made a major impact on the CIP proposal. Without more funding, we're limited in our ability to solve problems and to build the kind of healthy, just, and economically vibrant community that we're trying to build. It's especially true with the school system, where they have, a major portion of our capital budget in school projects, and inflation in school construction has, I will say, construction everywhere has been very significant, and they do suffer supply chain delays, but the costs have really had a major impact, and we could not build what was in last year's budget with the same funding that was in last year's budget. And so while we're able to provide MCPS with a 5.9% increase this year from last year's approved budget, and it includes some things I'm really happy about, like the new Burtonsville Elementary School, which we're doing instead of just renovating the building. These are really good things, but it also has meant that there are going to be delays in some other things in order to make their numbers fit in the budget. I will say we are still hoping to work with the administration, particularly since they have a very large surplus, and all counties are struggling with capital budgets because of inflation. We're hoping that the state will provide additional funding to Montgomery County and other counties so that we can stay on track and not have to delay some of the things that would get delayed preliminarily in this budget. We're optimistic that we can climb this wall successfully. So this is not the last word on the budget, but it's where we sit today. The budget also includes construction of more high school wellness centers. They're going to be added to Blake, Crown, Damascus, Einstein, Magruder, Northwood, Springbrook, and Woodward high schools, as well as planning for the future center at the Poolsville High School. We were also able to provide additional funding to Montgomery College to the tune of 2.8% increase over the last budget and a 2.9% increase for park and planning. One important project that received funding for the first time is the Wheaton Arts and Cultural Center. And this is an example of something we're funding because an opportunity came up that wouldn't otherwise exist. The county selected Montgomery Housing Partnership to combine an affordable housing development with the new arts center in the Wheaton Arts and Entertainment District. So it enables us to combine projects and helps bring down some of the costs associated with building the arts center because it's going to share elements of construction with the housing development that's going to go there. MHP is going to develop the former WMATA site off of George Avenue with 2 affordable housing rental buildings with 280 apartments, a standalone garage, and 40 affordable for sale units, continuing our push to get our nonprofits to provide more affordable ownership opportunities for people. The Art Center is going to include a ground floor building fronting on George Avenue. The center has 2 performance spaces, classrooms, gallery space, back of the house support space, and administrative offices. We also recommended $1.4 billion in funding for projects that help us move forward our climate action plan goals, including funding to provide a full upgrade of the county's recycling center, funding for planning and design for new transit maintenance depot to accommodate an expanded fleet, and a low emission maintenance and fueling charging facility, as well as funding for new HVAC systems for the EOB, the Judicial Center, and the 4th District Police Station that will also improve energy efficiency. So we're looking forward to working with the County Council on these projects. Overall, it's good to be able to increase the funding, and it's just unfortunate that this is not a year where we could fund 100% of all the increases.
Cleaning must-have from Amazon. I am telling you, if you have hard water stains built up on your glass shower doors,
Judy, thank you. Go ahead.
Okay.
Exciting.
Meanwhile, back at the briefing. This week, I joined County Council in honoring Asian communities that celebrate Lunar New Year with a joint proclamation read by our first Asian American to serve on the County Council, Kristen Mink. It's also an important time to honor families and traditions brought here in Montgomery County and now celebrated in Montgomery County. This county is home to many groups representing Asian countries and the Southern Pacific region. I recently met with a delegation from the South Korean Embassy that commended Montgomery County for creating a safe and welcoming environment that plays a big factor in relocations that Koreans make when they're either coming in as individuals or businesses to the States. Montgomery County is one of the places they associate with the kind of climate they want to be in. We're proud of our diverse culture here, and it impacts and enriches our culture for everybody, and it also boosts our economy. Two good things. National study found Montgomery County is the top place for talent in one of our most important industries, life sciences. A reputation for outstanding education and being a wonderful place to live can only be selling points if there's good word of mouth to go with it. And I want to thank our Asian American community for being some of Montgomery County's very best and most important ambassadors. Back to COVID now. Hospitalizations are busy with COVID-19 patients. Over the past several years, when we shared our weekly COVID-19 update, we often point to changes in case rates. A better barometer right now is the impact of COVID on our hospitals. Patients are coming in with complications from COVID or with other issues, and then testing positive for COVID. What that tells our health experts is that the virus is extremely transmissible in our community, accounting for just shy of 15% of patient beds in our area. That 15% may not sound like a lot, but it's a key threshold because it stands right now as the difference between our community level of status moving from medium to high. We should treat COVID-19 with extreme caution right now because it's sickening many people and driving them to the hospital and still taking lives. Hospitals remain busy. If it weren't for an overflow option that the county has at the old Adventist Hospital in Tacoma Park, which frees up about 100 beds countywide, our hospitals would already be in crisis mode. The best way to stay out of the hospital is to protect yourself and your family by getting vaccinated in the bivalent booster. And we know demand for shots have dropped significantly, and that's happening even as demand for rapid COVID tests in our county has shot up. It seems like many people have resigned themselves to getting sick and riding out this latest subvariant, and that's a mistake. I hear a lot of people just say, well, it's just like the flu. It's not quite just like the flu. Since November in the state of Maryland, there have been 43 deaths attributable to the flu. In the same time, COVID's been blamed for more than 500 deaths. That's 12 times as many deaths in the same amount of time. Close to 3 years since the start of the pandemic, more than 2 years since our first vaccines, we're still losing too many people to this virus. And it's not yet the same as a flu and not something you should take lightly. Please remember to voluntarily wear a mask in crowded indoor spaces or when you're visiting people at high risk of having complications with COVID, like friends who are seniors or relatives or those who are living in a nursing home or assisted living. And before I turn this over to the health team, I just want to congratulate the Department of Health and Human Services, Dr. James Bridgers, for being confirmed by our county council as our new Chief of Public Health Services. Dr. Bridgers has been an important contributor in our HHS department since 2019. He's been a critical advisor to me and our leaders in helping to explain our policies to residents and communities that we've served throughout the pandemic. And I look forward to our continued collaboration and partnership and the work that he'll be doing together with our new county health officer, Dr. Keisha Davis. They're a dynamic duo of public health awareness and engagement. And I'm going to turn it over to our public health emergency preparedness manager, Sean O'Donnell, for him to give us his report now. Thank you.
Thank you, Mr. County Executive. Going through the report, we have seen some decline over the last week in our transmission numbers. Of course, this, just a reminder, doesn't capture all of the rapid testing that is predominantly how people are testing now. But it's encouraging to see some of that come down, even as we continue to have elevated hospital visits, not only for COVID, but for a number of different reasons. Looking at our surveillance with some of the other East Coast cities, we've also seen that decline, New York City, Philadelphia, and the rest of our region. So again, this is encouraging that some of that transmission may be starting to recede. Of course, when we looked at our hospital census on Monday, it's still one of the highest rates of COVID patients in our hospitals all year. You'd have to go back to the really incredible impact that the initial Omicron had last year to get to that level. And about, as our county executive mentioned, about half of those patients with COVID diagnoses are at the alternate care site in Tacoma Park. Our ED volume has been very high. It remains very high. It's come down just a little bit over the last week, but it does remain higher than much of the past year. And when we look at what populations are ending up at our emergency departments, it is right now the elevated populations are our 65 plus. Again, those individuals, this is for fever and flu-like illnesses. So it's not just limited to COVID, but these are individuals who often have underlying conditions, and their hospital stays could be more complicated. When we look at our variants, as we track the variants, the projections are now that XBB is making up almost half of the cases in our region. This is consistent with the predictions from our federal partners who are tracking and typing these. Again, the XBB is an extremely transmissible version, which is basically how this is going. Now that most individuals in our area are vaccinated, it needs to be a highly transmissible variant for it to gain hold. Again, we've shared this data here about the differences in the case rates by vaccination status. And you can see very elevated rates for the unvaccinated compared to the fully vaccinated. The reason I'm mentioning this now is the data that we've had to this point, where we pull it from, doesn't go into detail about if those fully vaccinated people also have boosters or have a bivalent booster. So we've been working with our epidemiology team to try to get some better data to help us answer those questions. This is preliminary data, but it does compare individuals' breakthrough cases for individuals who had the original booster that was available for about 13 months versus the bivalent booster, which has been available since early September. As you can see, these are not the same length of time periods, but to this point, there is a marked difference in higher rates of breakthrough illness with that original booster versus the bivalent booster. Again, we know that these variants are primarily causing illness with people who have been vaccinated. So that's why this is an important bit of data. In each subsequent variant is going to be the same. They're likely going to be causing breakthrough illnesses. And so we wanted to share again, so far, this bivalent booster is keeping those breakthrough rates very low. Across all different age groups, it does differ by age, but on average, it's about 1.1% of individuals who've had the bivalent booster have had a breakthrough case of COVID. We'll continue to follow this, and we're hoping perhaps next week we'll have similar data looking at hospitalizations and death. We know that breakthrough cases will continue to happen, but again, we're hoping that the updated vaccine will help to limit the severe illness related to those breakthrough cases. Looking at our death totals, that they've been updated as we go through January. It's proving to be another higher rate or higher number of deaths in our in our county compared to previous months. And it's unfortunately not surprising given the very high transmission rates we've seen and high hospitalization rates. Again, I've mentioned we're hoping to have the data for you perhaps next week on data related to Montgomery County residents who have had the bivalent booster versus the previous boosters. When you look at hospitalization rates here, just at fully vaccinated versus unvaccinated, again, elevated for unvaccinated, but we're unfortunately seeing those who are fully vaccinated start to have some increased rates compared to, historically a year ago or so, where those were fairly low for fully vaccinated. Again, this is showing that you do need to get a booster to help provide that protection. So hopefully we can share some data next week on those that got the bivalent booster. And we make all these points because we are still seeing fairly moderate rates of people coming out to get their booster shot, their bivalent booster shot, and unfortunately larger disparities in our populations who are getting that compared to the initial 2 doses and maybe even the first booster. So that we're trying to emphasize the importance of getting this bivalent booster. Looking now at how flu has been affecting the nation, continue to see ongoing transmissions of the flu. Those numbers continue to go up, but they're increasing now at a much lower rate than they had been previously. So we're starting to see less flu activity, even though it is still going on. You can see in comparison that very small graph to the right. That's the peak of activity last year from influenza versus, this year it's been much elevated, but it's starting to recede now. So we're hoping this will continue. Our hospitalizations with influenza-associated hospitalizations have come down and continue to come down. And again, the total number of deaths across the state of Maryland is now at 43 for influenza. And finally, within Mpox, these numbers have, as we've reported previously, have greatly slowed. Only 1 new case of Mpox was identified across Maryland over the past week. So at this time, I'd like to ask if any of my colleagues, Dr. Davis or Dr. Bridgers or Dr. Stoddard, would like to add any additional points to this, to our presentation.
Nothing additional. I think just main messaging there, some key points for folks to remember that the vaccine is effective against XBB. And as we see that variant continue to rise and become dominant, reassuring that the vaccine is effective against that. And we saw, the breakthrough data that you presented, I think helped to elevate and escalate that. And reminding folks that getting the booster is still important. I think as folks, again, COVID starts to wane, we're seeing some promising results. The real push is that we want to protect our hospitals and we want to help keep our hospitals from overflowing. The more COVID that is circulating, even if that COVID is mild for most folks, it still can be severe for some. And the more COVID that's out there, the more people who are going to be severely sick. And so we want to continue that message of getting vaccinated, masking if you're going to be with high risk folks or in tight settings, washing your hands and testing before you go.
Thank you, Dr. Davis. Dr. Bridgers, Dr. Sauter, any opening remarks?
Sure. Thank you, Lorna. I just want to thank our county executive, Mr. Elrich, for nominating me as the county's chief of public health and working very closely with Dr. Davis. And, we look forward to increasing our public health awareness. She's just spelled out what we should do to stay safe and protected. So I want to thank her for all the work that she's doing now, coming in and hitting the proverbial ground running.
Thank you. Dr. Stoddard?
I'll add my congratulations to Dr. Bridgers. But I also want to note that this afternoon at 3 o'clock, MCPS is organizing a very important conversation about opioid overdoses and overdoses in general with youth that we're seeing an increase in our young people. I know Dr. Davis and Dr. Bridgers and Chief Marcus Jones and I believe Dr. Roland Santiago will all be present for this briefing this afternoon. We encourage members of the media to participate in this, but also on behalf of the entire executive team, we recognize how important this issue is. We are working on additional measures to support the agencies to help address this. And there will be a opioid focused forum on January 28th that we encourage residents to participate in. And we're actually working on some additional things with transportation to allow more people to participate in that forum that we'll be announcing over the next couple of days. So just really want to impress upon members of the public, particularly, have a conversation with your young people about opioids. I have a 13-year-old daughter. We had a conversation this weekend for the first time. She didn't know what fentanyl was. I had to explain to her what it was, why it was dangerous, how it can present itself in prescription pills and other things, or people claiming are prescription pills, and had a very frank conversation with a 13-year-old. So that gives you a sense of how seriously I'm taking this, and I encourage parents across the county to take this with their young people as well.
Thank you, Dr. Soto. Thank you all for your opening remarks. Members of the media, this is the time that we open it up for the Q&A portion of this presentation. I do not see any requests for questions on the chat. We'll give it a second or two.
Well, I have questions about housing. Is this only for health
No,
COVID stuff?
no,
No, what can I ask those now?
no,
or
no,
do
no.
I-
It's not only for health stuff.
Oh, okay, got
This
it.
is open.
Yeah,
Yeah,
well,
go ahead.
hello all, happy new year. Nice to see some of you again. This is Dan Brendel with the Washington Business Journal. I had two questions regarding housing. The first is the AHC project, Mark, that you spoke about at the beginning. I got the press release with the the ladder of affordability in there.
Yeah.
The rentals are 30 to 60% of area median income. The for sale condos are 30 to 50%, and the 3 for sale single family homes are
Yep.
at 70% of AMI. Can you say how rare or commonplace those depths of affordability are? I cover housing enough to know that they're not unheard of. I would think that maybe it's uncommon that entire projects would be at those affordability levels, as opposed to
Yeah.
just a few handfuls of units within a project. But can you say how rare or commonplace this is?
It's pretty rare. There are a number of speakers who talked about how rare it was, including the guy from the state of Maryland. You don't get that number of units without that complete mix of affordability. And we're only able to do it because, we were the drivers of the project. So we set the parameters for what we were looking for. People who were bidding, with us on using property that the county owned. And so we had the ability to say, this is what we want. And that's why, we've got kind of similar goals with what we do with the other 18 lots. This wasn't part of the original 18 lots that we put out there. So we're trying to use the same kind of principles to drive greater affordability in the other projects. If this was a Montgomery County project, if it was in Bethesda, you'd get maybe 15% of the units affordable. They'd only be affordable to people making 60 to 75% of income, unless I had some leverage to exact, a higher level of affordability. So most of the people would be completely left out.
You're referring to the inclusionary policy there, right?
I'm including our moderately priced dwelling unit. I've said this before. It's a program that was created in the 70s. And in the 70s, when the county was 95% white and most people were professional or quasi-professional tradesmen and things like that, the notion of who needed housing, they would say, would be the teachers, the firefighters, and the policemen. That was the language that was used around this program. That's been our policy, basically unaltered, despite the radically changing composition of the population of Montgomery County. So have determined that we've got to change it. So the things I control, the easiest things to change, we're going to be submitting changes to the council to change our policies. I said today I was going to introduce basically a complete communities approach to what was once our the moderately priced dwelling unit program, because it's not a complete community if you only serve people from 65 to 60 to 70. Everybody else is left out on the street. So we're going to come up with policies that if this is what the council, if they want this, this is what they're going to have to do to get it. And I think one of the council members cited what I think is the alarming statistic that 40,000 people come here by 2030. 75% of them, or 30,000, need subsidy. And you've got policies that don't generate more than 15% subsidy. So anybody can do the math and understand that our policies don't match the needs. So we're going to offer policies that drive us closer to addressing the needs here in the county.
So just to make sure I understood the way I would summarize that, what I heard was that when my average reader hears about the provision of affordable housing in a project, it's probably referring to a much smaller number of units at a higher level of AMI than this AHC project. What's unique about this AHC project is that it goes deeper in affordability than normal and provides a greater number of units at that deeper level than normal, right?
Like all units instead of 15% of the units.
Got it.
In the rest of the county, it's 12.5%, so it's even fewer.
I had another housing question, but I don't want to, I can come back at the end if there are other reporters who have other questions.
Let me check the chat, David. I think you are pretty much, no, you can go ahead. Keep going.
Okay. Then the other one was you had covered this, you touched on this briefly also, the $30 million or so in repaid loans for the NOAA, kind of like recycling NOAA funds.
Yeah.
I noted that in your press release that came out, but I was unclear how new that money was, because I mean, those loans were always going to get repaid. So what was it that they were repaid ahead of schedule, or what's new about that?
No, actually this was a new infusion of funding we put in there because we were trying to, in response to requests from the nonprofits about not having money that they could grab quickly and easily in order to act on something, we put those funds in there so we could provide the bridge. You want to exercise right of first refusal, you can use that money for the bridge and then eventually you get paid back. But most often it would be 3 to 5 years, sometimes a little bit less. Getting this money back this quickly is really good because it meant they were able to wrap up their permanent financing and take us out of that, which puts this money back on the street. These are the things that I think are really helpful to us. This, and as well as pushing the ownership piece. If I give money to a nonprofit for rental units, then I'm probably in that project with that money for years, because that's part of what makes the numbers work. If to the extent that projects become ownership projects, we get the money back as soon as people start taking ownership and getting mortgages, which means you can take the same pot of money and multiply it over far more people over a period of time. If I had to provide this level of funding every year for rental housing, we would be really challenged with debt.
So that's my point though, right? This is recycled money.
Yeah.
That's
But
coming back from loan repayments.
But this is new money that went into the into that program, so we had more flexibility than we did.
So it's not repaid loans then. It's new money, not recycled money.
It is. When it went out, it was new money. When it came back, it's now recycled money.
So Dan,
we increased the new money that we were putting in.
I think one of the things that we wanted to say with this is, it's not unique to this government, this administration, that when you launch a new program, there are naysayers that say it's not needed, it won't work as you're proposing, and we're demonstrating that with this quick and sizable repayment, it is needed. There are opportunities for us to preserve naturally occurring affordable housing, to make sure it's not, the market forces don't drive it out of the affordability range. So we put the money up. Some people said we couldn't do it, we wouldn't move quick enough, it wouldn't work. We got it done, we got the money out, we participated in a loan, and it came back very quickly so that, again, it can be recycled. So It was new money last year, and it's a demonstration of the proposal the county executive put out there actually worked. There is a need. We can fill an important gap by having this money available. And within a year, $32 million was repaid, or 30.2. I'm sorry if I'm getting the number wrong. And we're able to just put it right back in and recycle it. But in order to spend it, obviously, we have to appropriate it in order for it to be recycled. But again, I think it's again an example of a program we put forward. It worked, and we're able to get money right back on the street to help protect and preserve the next naturally occurring affordable housing project that comes up on the market.
Okay, thanks. Yeah, I might have more questions about that, but maybe I can get linked up with a staff member who's appropriate later. I appreciate your time. Thank you so much.
Thank you for asking, really.
Thank you, David. I do not see any more questions from members of the media on the chat. We'll give it a second, see if anybody else wants to ask questions. Reporters? No questions? Okay, I guess we're done for today. Thank you for joining us. Have a great afternoon, everyone. Stay safe. Bye-bye.
Thank you.
Thank you.
Thank you.